All right. Good morning, everyone. Thank you for coming today to today's webinar. My name is Marshall Bangs. I'm Neurosom's Investor Relations Specialist, and today's webinar topic is, Can AI solve sleep? We're going to hear a speech today from Dr. Roma Shusterman. And to start things off, I would like to introduce Neurosom's CEO, Don Tucker, to give a brief overview before we start today's talk.
Thanks, Marshall. We've had a series of webinars now. This is the second one in the series on how AI is changing healthcare. In our first webinar, we did an overview of the use of machine learning, convolutional neural nets, to classify the human EEG in real time. We've been working on the EEG for many years, the brain waves that show us what the brain is doing. And now, using convolutional neural networks, we can characterize what's happening. For example, what stage sleep the person's in. Today, we're going to look at a different way that advances in AI are changing healthcare, and this is through the interface with the person, to allow the person to understand important healthcare aspects, in this case, cognitive behavior therapy for insomnia. Take it away, Roma.
So, at Neurosom, our main focus is sleep problems. Our main goal is to bring a sleep solution to people suffering from insomnia, but also people who just have a poor sleep and even not diagnosed as insomnia. In the first step, we introduced a WISP sleeping headband as part of our Neurosom sleep ecosystem. So our headband monitor brain activity during night, and we do this. It's wirelessly communicating with a NVIDIA-based GPU model, where we monitor this EEG activity, and this shows this 3 channels of EEG2 recording from the front side and 1 on the mastoid. And we're using this EEG to monitor sleep stages. And here is in real time, you can even see there is an event that our NEAT algorithm detected N3 deep stage of sleep. So at the end of the recording by morning, we have a sleep quality representation of the last night, which is expressed in a hypnogram. It shows how person slept, how much time a person spent in different sleep stage. But this is not all. We're also using this real-time detection algorithm to see when person is actually all in N2 stage of sleep, in deep stage of sleep, then where the system triggers and sends signal to a headband to start electrical stimulation, and in order to enhance deep sleep, pushing people stay longer in this N3 stage of sleep, which is associated with a better sleep and memory formation. We already published one study showing that these protocols improves deep sleep and enhance duration of N3, and we're now close to finish the second study, which show even better results so far. But overall, from the sleep perspective, this solution helps people to stay longer in a deep stage of sleep. But this is not a full solution. What happened if person is too tired and a person cannot reach this deep sleep. If person worked too much, or person had a few alcohol drinks or coffee drinks before night, sometimes they even cannot get into this deep sleep. So the full suite of sleep solution should also address also the good sleep practices, and that's where we're coming now with extending our ecosystem with behavioral therapy for insomnia. So the cognitive behavioral therapy for insomnia, or CBTI, focuses on restructuring the thoughts, feelings, and behaviors that are contributing to insomnia. A CBTI is a proven technique where most individuals who try CBTI experience improvements to their insomnia and better quality sleep. So with overall this package of CBTI, or cognitive behavioral therapy, and WISP should work on all sides and all sides of sleep. So helping person to fall asleep faster and keep a person longer in this deep sleep. So on a so what is a CBTI? CBTI is a set of techniques that it involves a number of trainings sessions that they consist stimulus control, sleep restrictions, and relaxation trainings. And so this helps person to have a better sleep routine, to be prepared for sleep, and treat sleep in a better way. And also, second part of this behavioral therapy is also sleep diary, which means monitoring sleep performance as over some period of time to see how this improves. So cognitive behavioral therapy usually is presented by a trained behavioral therapists, which meet their 5, 6, 7 meetings with the therapist, where during these meetings, therapist is going through each session and presents different techniques and different strategies and routine how to improve sleep quality. And then during the sessions, the therapist is also going through this sleep parameters. And this is a proven technique. But what we so the limitation of this is indeed availability of this therapist, cost of this therapy, and what some alternatives to this human therapist is a digital application for cognitive behavioral therapy. So it's a structured application where you have the same 6 trainings. It's presented in a very structured way, and it transfers this information and to patients. But the limitation here that digital CBTIs, they lack proper engagement communications. It's hard-coded applications. So, and this goes to that eventually people drop from this treatment, while it still can be useful and it's proven to be helpful, but it requires a self-discipline and to maintain this. So what we thought, wouldn't it be cool if you have a therapist, virtual therapist, that it will be part of your routine and you can communicate with it anytime during the day before sleep, which help you to maintain your sleep routine, which will guide you and will be as a digital application as CBTI, but with actually empathic engagement. So how do we do this? So what we want to do is actually we want to build a virtual actors that will present and will lead, will guide people on this conversation. And this is example of a virtual avatar. This is a virtual avatar of my 15 years old daughter that giving presentation of about quantum mechanics. Oops, sorry.
Quantum mechanics is a branch of physics that studies the smallest things in the universe, like atoms and particles smaller than atoms. It tells us that these tiny particles can exist in different states at the same time, which is known as superposition. It also shows that observing these particles can change their state, a phenomenon called the observer effect.
So you should know probably that this quantum mechanics curriculum is a little bit in the later ages of not 15 years old. So what happened here? We took the artificial intelligence that behind this technology that it takes. My daughter was presented 2 minutes of a speech and the video. AI learned this, and then AI transfers this to any other text that is fed to this virtual avatar. So, and that's one of the ideas that when user during the night interacts with tablet, that's where we will have avatars with different level of engagement, different possibilities, where they will run this through the sessions, then they'll ask person to fill diary, sleep diary, to provide feedback on how long the person slept last night, how many naps did he or she took last night, and then so all this will be later analyzed by Bell in our cloud. So this is a front end. This is what people will see, but behind, what's the engine behind this? So behind this, we have a large language models that we are implemented to communicate and to run this behavioral therapy. So the concept of large language models is still scaring people, and regulatory agencies also not sure how to treat them properly, how to reduce risk of these applications. So we prepared manuscript, and the manuscript should be appear online in today or tomorrow, in next few days. So there, where we developed a strategy which will claim that implementing this strategy, the AI can be implemented in the medical devices in a safe way. So if there will be interest, I have additional slides that I can go in details about the strategy. But right now, I just want to outline the general idea of this. So to general knowledge that large language models, they suffer from providing wrong responses or hallucinations. So which sometimes caused because they were trained on unverified data, and sometimes because this is not a deterministic model. So to address the first part, we guide the large language model to focus and to respond only based on very limited and verified data set that is related to a cognitive behavioral therapy. On the second part, to reduce the hallucination during the non-deterministic nature of the large language models, we implement here a technique which that was motivated by active inferences in human cognition. So we have two therapists. We have two large language models that are verifying each other. So whenever there is an input or question from user is coming, patient, one agent is drafting response, and then it sends this response to a second agent, which again verifies response not only for correctness, but also whether the response is actually addresses the user's concerns. And then after this verification, the second agent, supervisor agent, comes back with conclusion. Either the therapist agent response is good, and then it will be presented back to user as an answer. Or this response was not fully correct, and then it presents its own corrected response. So this combination of these two agents in this approach appears to be remarkably good. We ran a validation study. So apologies. So this is just example of patient question related to the cognitive behavioral therapy. So the person saying that he or she worries too much, how can he or she stop worrying about this? So the therapist initially drafted response that's recommending that not to fall asleep fast while worrying, as it can interfere with sleep. So it's not answering actually directly the question that a patient posed. And then supervisor agent actually caught this, and the provided information on how to improve sleep and how to address insomnia, but is not directly addressing the issue of how to stop worrying. And then based on this, supervisor agent fixed this and providing better answer. So we took this approach and performed validation study. We generated a number of questions, and then we send this set of questions to a clinical therapist. The clinical therapist provided we ask clinical therapists to provide both appropriate and inappropriate responses to these queries. And then we also run these queries through our virtual sleep coach AI engine. And then it provided 50 responses. So then each query had 3 different responses. And then we randomized them in a sequence. And then we send them to the second clinical therapist and ask to rate this each of 3 responses per each query. And then we did the same symmetrical, where there's a second therapist got this, her queries, and then she sent provided her responses, and these responses were sent to the first therapist. So overall, we had a pool of 100 questions, and we had a set of 3 responses to each question, and then what in the next slide we show the ratings of the responses. So the responses were rated on the scale 1 to 5, where 1 is inappropriate therapeutic response, and the 5 is the very appropriate proper therapeutic response. And then we show that amazingly, but our AI approach is even outperformed the human ratings. So with this approach, as I mentioned before, we have a manuscript which should appear in the next day or 2 online, and we're claiming that we propose a method, strategy, where when following carefully the strategy of dataset preparation and having this unique configuration of AI agents on the back end, we are claiming that actually AI can be utilized in medical devices. So with this approach, we will have a full suite of products that will close a loop from perspective of addressing the whole sleep pipeline. So starting from training person how to better fall asleep, how to follow routine, then monitoring sleep during night with our neat AI algorithm, and then presenting stimulation during night to keep person longer in this deep sleep, and then the reports will be sent back to AI for analysis and review before the next session, before the next night. So, so right now we're working with FDA on this virtual sleep coach for de novo submission, where we're arguing and we're trying to convince them that this approach is a legitimate approach, and this, even if they accept this, that the same approach can apply to other large language models in medical devices. We're working on right now also on integration of virtual avatars for this better patient virtual sleep coach interaction. And we're putting a lot of efforts in cybersecurity. We have a good knowledge. We right now we follow this most recent cybersecurity recommendations with our NEAT machine learning package for which we submitted for 510K. But we recognize that cybersecurity and in terms of personal information and hyper compliance, this is very significant part in convincing people that to convince people to use our technology. So, and to finish this presentation, I just want to link back, and Don already mentioned this earlier, but to link back to this previous series of webinars that we have on Neurosome website. So if someone wants the videos of the previous AI webinar and among other also very interesting seminars, science and research seminars available for for study. And let me finish this. Just thank you for this, for listening to me.
Right. Thank you, Roma, for the presentation. Now we'd like to open it up to a bit of Q&A session. So we have a Q&A function for the chat. Go ahead and put any questions into the chat. I think there's also a poll going up. And right now we have a few questions to start with. This is a good one maybe for either Roma or Dawn. This question asks, isn't one of the best sleep practices to limit screen use before and during bed? Wouldn't the use of an avatar on a screen counteract the recommendation of reducing screen time before bed?
That's a good question, really good question, and we will need to come with a proper timing, how much before sleep person can be engaged with a virtual sleep coach. Whether it's half an hour or hour, we will need to study these recommendations.
Yeah, I think that's right, because we want to be sure to allow the wind down time, to allow people to become fully relaxed. So, but I think that's practical, because really what the avatar is doing is to help, certainly in training with using the WISP, the headband for deep sleep enhancement. But that can be done well before bedtime. And I think the other practices of CBTI are also not done right at bedtime. The only thing that's done then is relaxation therapy. And that can be done without screens, basically through a simple audio recording that helps the person achieve deep relaxation prior to falling asleep.
Good deal. Our next question is asking if we plan to open this app prior to FDA submissions for research or beta use.
Yes. Yeah, that's right. I'll answer that one. We want to have research laboratories help us to evaluate and develop this technology. Both the CBTI, but also particularly the electric sleep therapy with the WISP headband. So we are now trying to keep up with the demand. There are a lot of research labs that want to do research. And in fact, Roma right now is scrambling to be able to build enough of these to meet that research demand.
Good deal. And the next question is someone asking a clarification question on whether this is intended for diagnostics or consumer use.
It's not a diagnostic. It's a therapeutic. The cognitive behavioral therapy, it's a known therapeutic application. what we want to put, we want just to replace the human with a virtual therapist without changing the therapy itself. And this will just allow people wider access. So therapeutic use is a CBTI therapy. Yeah, it's not intended for diagnostics.
That's correct. And I think the goal is to take it to FDA with a 510K mechanism, which basically means it's similar to CBTI. It's just done in a simpler mode. But we do think at this stage, it's important to have the physician monitoring each person with insomnia, whether for electric sleep therapy or for the virtual sleep coach. We want these to be medical devices and prescribed and monitored by a physician.
Good deal. And one question asking about information on the equity crowdfunding campaign. I can answer that one. There is a link in the chat posted by Corn Tucker that should be available to everyone. And that is the link to the Red Crow offering, which is who we've paired up for running this crowdfunding campaign. And that has all of the information as well as the sign up in order to actually make an investment in Neurosom. And we have a bonus shares offering that we've extended through October. So before October ends, it's a good time to get a bonus deal on shares. And that is available via the Red Crow link in the chat. If anyone is unable to access that for some reason, go ahead and ask another question and we'll send you the link directly if you can't get to it. And our next question following that is, how does the virtual sleep coach contribute to the overall vision and the other components in the Neurosom sleep ecosystem?
So the Neurosom sleep ecosystem, with the help of virtual sleep coach, will address the full panel of sleep. Now it will help to fall asleep faster. It will increase deep sleep during the night, and then it will follow up and analyze data in the morning for the next session. So this is not only focusing on just sleep onset or longer decreasing sleep onset or increasing sleep duration, but it focuses on the whole concept of sleep.
Great, thanks. Yeah, no, that's exactly right, Roma. And I would emphasize that this is a platform for a continuing integration between the brain measuring brain waves to know what's happening in sleep, manipulating the brain waves, such as through our deep sleep synchronization by applying electrical currents externally. That's kind of the core of our technology. But as Roma said in the beginning, we knew this would not be a complete sleep therapy, that CBTI gives a lot of good practice in behavioral methods and psychological methods, including deep relaxation. So it was important to build this kind of end-to-end closed loop so that AI is giving us a usable and engaging interface with the person at the same time as we're directly manipulating and monitoring the brain with AI through EEG and transcranial electrical stimulation. And what I would emphasize is that as we've been planning this, we're just getting started. That this direct communication between the brain and AI is going to give us some pretty interesting techniques for improving psychological function in sleep and in daytime activity. For example, one of the things we know is that the onset of mild cognitive impairment and then the onset of dementia are associated with certain brain changes, the uncoupling of slow oscillations in deep sleep from the spindles between the thalamus and the neocortex that help us to consolidate memory. And when those start going bad as you get old, your memory starts getting impaired. Well, now that we have this platform technology with AI direct to the brain and AI interfacing and talking with the person, we can start introducing new measures, particularly this spindle slow oscillation coupling, that will help us really understand more about where the person is in their lifespan development and where we can intervene with improved sleep to help them have more healthy aging.
Thank you, Don. And maybe another question for you is describing a bit about the marketing plan for Neurosom and for the virtual sleep coach.
Well, here we are. This is part of our marketing plan. Our goal really is to explain the science that we implement carefully, to explain the medical practice. So, for example, it was very important to have Dr. Ruth Benka in our previous webinar help to characterize how techniques like we're developing could be translated into medical practice. Because this is an ecosystem of doctors, healthcare systems, insurance payers, and patients. And part of our marketing plan is to reach out to them, but only to do so once we've studied what their problems are and what their interests are.
Good deal. And maybe another comment for Roma, but asking a comment on the privacy and confidentiality of patient and user data. So keeping HIPAA compliant and cyber secure, how that might be implemented for the virtual sleep coach.
So we already have very good experience with right now with two medical products not yet cleared, but that we submitted to FDA as 510(k) applications. And both of them are software as a medical devices where we implemented all necessary cybersecurity and HIPAA compliant measures. So we'll keep monitoring this because this is indeed important issue, and we're implementing cryptography on all the communications, all wireless communications. So that's something that is indeed, I'm taking this as a personal commitment.
Yeah, it's a key capability, and we want to be sure we can guarantee that privacy. One of the things that I was impressed with that Roma has done is to engage a cybersecurity expert to try to hack our system and look for vulnerabilities. That's the way that we can actively assure that we cannot be hacked, or at least not by the most creative people we can find. So it's going to be an ongoing issue. It's part of life in the digital world that we maintain cybersecurity.
Good deal. And our next question is asking, how do you reach the public in order to educate us about these tools? In other words, we know restorative sleep can be challenging, but how do you intend to reach both the physician and the patient in order to connect and educate them on these better sleep tools?
Very good question. We're still learning about this. We have personal interactions with people with sleep problems and with physicians. And we have seen the webinar format as one way we could reach a larger audience to get that kind of interaction and feedback. We also often, in order to interact with physicians, we will engage expert advisors who themselves have grown up in the medical community and know a lot about the reactions of physicians. And some of these are actually sleep doctors. physicians who specialize in sleep medicine, and they interact with patients every day. So this is already giving us a very good feedback to understand the needs of this community, and it's going to be ongoing. We're going to have to be closely connected with people on the front lines so that our products are not only interesting scientifically, but they meet the needs of people with the problems and dealing with the problems.
Good deal. And our next question is asking about the integration between Neurosom and CPAP usage, how we plan to integrate and morph together with patients using CPAP as well as the Neurosom sleep system.
So far, I don't think we had any plans for this integration, but Don, I don't know, maybe you can provide your opinion here.
It's an important question. First of all, we do want to improve our assessment of sleep apnea. Right now, this has to be assessed with a different technology. We do not have that integral to our assessment, although what we find in the literature is that sleep apnea could be assessed from the physiological recordings that we get from the WISP headband, including not only EEG, but heart rate and respiration. So that's going to be an important topic for future use. Immediately, many of the people in our clinical trials do wear a CPAP. For example, we have a trial with that's just getting piloted right now at Northwestern University with young adults with Down syndrome. Many of them use CPAP, and in the pilot studies, they were able to wear the WISP, put the CPAP mask on over top of it, and did not have trouble with that. We did not see interference. We saw good communication. So this is an important topic that we're only beginning to understand and address effectively.
All right. And I think a potential related question is questions about integrating with not just physicians and sleep physicians, but dental physicians as well, dentists, and the potential integration of applications or appliances such as CPAP and Neurosom in the context of dental equipment that might interfere.
Yeah, this is important as well. There are dental appliances that also help with breathing. And that's a key part of addressing apnea. And so we think that certainly from a marketing point of view, we want dentists to understand how our technology could be interfaced with the treatment with dental appliances as well.
Good deal. And another question on the research side is asking how open or modulatable the device is for researchers, if the algorithm is accessible, if raw EEG data is available, and how much researchers can expect to be able to open up the Neurosom sleep system and modulate it themselves.
So the raw EEG data is available for researchers. They can study this and they can analyze, download this for analysis, but the neat sleep staging algorithm is not open for modifications at this moment. We just want to ensure the robustness and because we're providing an algorithm that we're in the clinical validation on. So that's where we didn't want to do this open source.
That's correct. Although with the architecture that we have, any other analytical algorithm, whether conventional signal analysis or AI, could be inserted in line with the technology. Now, to do it real time is more of a challenge. That's an engineering challenge that we would have to support on a custom basis. But once the data is uploaded to the Flow database and workflow management system, then it's very easy to access, such as with Jupyter Notebooks, a very powerful and flexible user interface for developing analytical techniques. And we have customers doing that right now.
Another very good question. Asking more so on the billing side, who pays for Neurosom, both device and subscription services? Is the goal for health insurance to cover?
Yes, that is our goal. We think there is a market for private payment well before we have health insurance coverage. But part of the strategy for developing Neurosom will be to seek breakthrough device designation from the FDA. This is part of our FDA strategy. That will open up, at least under current congressional guidelines, the Center for Medicaid Services to provide immediate reimbursement during the clinical evaluation period. So yes, there's a long kind of a lead time to get into full health insurance reimbursement, and that's part of our goal. Although we do see a private payment avenue that can open up in the near term.
Good deal. All right, I'd like to open up and encourage any other questions or comments, concerns. Linking back to a prior comment you'd made, Dawn, with the structure that exists now, if there are market advancements in AI technology, is the virtual sleep coach going to be able to keep up with those advancements and adopt new models of the LLM agents as they progress, like the new Chat GPT-4, if there's a 5 that comes out tomorrow, obviously with some time to lag and implement. With the structure that we set up, is it something that can take on those new agents and improve its capabilities as AI seems to advance just about every day?
Yes and no. The no is easier to explain because we have to validate each new implementation. So right now we're validating the Meta AI, which is actually released directly to developers, Llama. And we have Llama 3 right now, which we like a lot. It's performing very well. And so we're doing our validation studies with it. And it has the capability that it's totally within our premises. We don't have to ship off stuff to OpenAI and hope that we can trust their cybersecurity and everything else. So there are good reasons why the Llama strategy is the best one for short-term FDA clearance. We think that's our guess. FDA will tell us what they think about it. But this will be a continuing issue because we're very impressed with the new Chat GPT-4 and its capabilities and would like to introduce that into a therapeutic application. But the FDA clearance and cybersecurity are the #1 concerns for us right now, and we're finding very good LLM performance from Llama 3.
Good deal.
So you have to ask that question every 6 months.
Seems to be. All right. Any closing comments, questions, concerns from the audience or panelists? Looks like that might be it. All right. Thank you for attending, everyone. We have information on our website, neurosom.net, and also if you go to redcrow.com, invest.redcrow.com, that will have all of the information for our crowdfunding equity campaign, and everything will be available there. There is a bonus shares opportunity extended through October. So now is a really good time to jump in and see Neurosom grow. That is a pretty substantial bonus share program running through October. So please go ahead and check both of those out. Any other questions can be dropped to info@neurosom.net if you want to send us an email. And I'd like to thank everyone for attending today.